CMA Medical Assistant Practice Test for Administrative Knowledge 2023 50 questions with answers. Disarming the alarm, unlocking the door, and turning on office equipment is all part of opening the office. As each patient enters the office, the medical assistant should immediately greeted and asked how the medical assistant may assist them. When a patient is standing at the registration desk, the medical assistant should provide patient privacy while discussing any PHI. Verification of insurance information should be performed prior to the patient seeing the provider. A patient's identity may be verified by state-issued ID, state-issued driver's license, passport, employee ID with picture. Information to new or prospective patients should include all of the following except any lawsuits pending against the provider. A managed care referral should be verified prior to the patient being seen. Changing the telephone to the night message, preparing the bank deposit for the day, and backing up computer files are all part of closing the office. The waiting room should be set up to include all of the following except pillows and blankets. The patient history form will include all of the following except reason for the visit. Suggesting a community referral and making sure that insurance forms are complete are part of the job of a patient advocate. Veracity is proactive duty. Advanced directives include directions regarding medical care. The medical assistant must practice in a fair manner in regards to all patients. Application software includes word processing, spreadsheets, telecommunications, and database management. The Americans with Disabilities Act prohibits discrimination based on physical and mental handicaps and requires the medical facility to provide Braille elevator floor indicators, handicap parking, wheelchair ramps, handrails in halls and bathrooms. When ordering supplies, which of the following forms are used? Requisition. Ergonomics is the science of adjusting the work environment to the human body. The Centers for Disease Control and Prevention is responsible for the study of the transmission and control of communicable diseases. Hand washing should be performed by all office personnel in both the administrative and clinical area. Passwords and activity monitoring systems are types of safeguards for PHI. The purpose of the medical record is to provide continuity of care, legal protection to the medical office, quality of care continuum, information for research and education. Creating, monitoring, retaining, and destroying medical records are parts of medical records management. An active patient file is a patient who has been seen in the office within the last 3 years. When destroying a paper medical record, the record may be shredded. The National Childhood Vaccine Injury Act of 1986 requires immunization records be kept for forever. The terminal digit filing system is read from right to left, locking all areas containing health information. Shutting down computers when not in use and never sharing your password are all standards required by HIPAA. The patient's health insurance company may obtain FI when the patient has signed a release of information form. A source-oriented medical record is patient information arranged by who supplied the data. Laboratory tests are put into the chart by chronological order. When charting signs and symptoms felt by a patient, the medical assistant should use patient statements. Open hour scheduling is when the patient arrives at their convenience. Computerized scheduling allows information to be accessed from multiple terminals. A search to be performed for patient information. A search to be performed for a specific time and day. The generation of reports regarding patient load. When a patient arrives more than 30 minutes late for a scheduled appointment, the medical assistant should reschedule the patient so as not to inconvenience other patients. When a patient cancels an appointment, a notation should be made in the patient's chart. Prior to scheduling a procedure outside of the office, the medical assistant should notify the patient's insurance carrier to determine coverage. The charge the policyholder pays to keep the healthcare policy active is called the premium. An expense that is not covered by a health insurance policy is known as an exclusion. The oldest and most expensive type of reimbursement obtained from a healthcare policy is a fee-for-service policy. Medicare Part A covers hospital benefits. A private insurance which pays an amount between Medicare benefits and patient payment is known as ICO. The goal of this program is to identify improper payments made by Medicare and recover overpayment and pay underpayments. RAC, the payment system used by Medicare, is the RBRVS. When determining medical necessity, the insurance carrier will review the diagnosis and procedures provided. Which of the following planes divides the body into anterior and posterior portions? Transverse. Which of the following systems pumps and distributes blood throughout the body? Cardiovascular. The four major types of tissue in the body are muscle, nervous, epithelial, and connective. The upper respiratory tract includes all of the following except the bronchi. The accessory organs include the gallbladder, liver, and pancreas. Hydrocele means swelling of the testes. All of the following are true about leukocytes except leukocytes are responsible for blood clotting. Tendinitis is an inflammation of the tendon. The function of the skin includes all of the following except transportation of immune cells. The nucleus is the control center that directs the activity of the cell. Cholelithiasis is gallstones. The sensory organs include all of the following except the pharynx. Which of the following terms means the surgical removal of the kidney? Nephrectomy. The combing form cost refers to which of the following anatomic structures? Rib. All of the following components are a part of the Sigmund Freud's theories of psychology except behaviorism. Which of the following terms means difficulty swallowing? Psyphagia. Cognitive theory offers an approach to psychology that encourages individuals to examine errors in their thinking. Which suffix means surgical repair? Plasty. Which of the following conditions is commonly known as a bruise? Hematoma. Each of the following identifies one of Elizabeth Kubler-Ross's 5 stages of grief except shock. The most accurate definition of defense mechanisms in psychology is strategies individuals use to avoid difficult or painful feelings. All of the following statements about renewing the CMA credential are true except the CMA credential is required in order to practice in the medical assisting profession. Which certifying agency allows a medical assistant to use the CMA credential? Commission on Accreditation of Allied Health Education Programs (CAHEP). Which type of resume is written specifically for an advertised job? Letter of recommendation. Which of the following incoming calls should the medical assistant transfer immediately to the physician? The emergency room calling about admitting an established patient with chest pain. A physician who specializes in disorders of the eye is known as which of the following? Ophthalmologist. When the medical assistant is preparing to answer incoming calls, what supplies or items should he or she have readily available? Appointment book, calendar, message pad or notepad, and pen and pencil. The information needed to make a return appointment for an established patient includes all of the following except patient's employer. A patient's neighbor calls, stating that she is concerned about her friend and would like to know what is wrong with the patient. The medical assistant should tactfully refuse to release any patient information without the patient's written permission. When responding to a hearing-impaired caller, the medical assistant should speak a little more slowly and little more loudly. The best way to handle an unidentified caller who insists on speaking with the physician but refuses to give her phone number or the reason for her call would be to ask the caller to send a letter to the physician. Which of the following conditions is most characteristic of an asthma attack? Dyspnea. To obtain confidential patient information, which caller does not need a patient's written consent? Referring physician. Which of the following situations is not considered to be a reportable incident? A negative result for HIV. Which of the following terms means the thing speaks for itself when applied to the law of negligence? Res ipsa loquitur. Which type of insurance would cover the medical expenses of an employee injured on the job? Workers' compensation. All of the following are reasons for the proper documentation of procedures performed in a medical office except information documented in the medical record may be used to reassure an employer about the health of an employee. Which of the following terms refers to the narrowing of the urethra? Urethrostenesis. Which of the following is the correct spelling of the term for an enlarged spleen? Splenomegaly. The Personnel Record Act prohibits an employer from keeping information about an employee's political affiliation. Which of the following is an example of an open-ended question? Would you please describe the exercises you do each day that tend to cause the chest pain you are experiencing? When should the W-2 form, the wage and tax statement, be given to an employee? annually in January. All of the following may interfere with the therapeutic relationship between the patient and the healthcare provider except empathy. Which of the following statements would be an example of stereotyping? All elderly patients have difficulty walking. Which of the following terms refers to the surgical removal of a lymph node, lymphadenectomy? Which of the following is not considered a special accessibility alteration designed just for disabled patients coming to the physician's office? Mats on the floors near entryways to prevent patient falls because of wet floors. Which organization registers physicians to prescribe controlled substances? Drug Enforcement Administration D. Which of the following describes a wrong and unlawful act performed by a physician? Malfeasance. A legal, valid contract may include all of the following except any to individual. Which of the following terms describes written statements made to damage an individual's reputation? Libel. All of the following actions may result in revocation of a physician's licenses except prescribing legal drugs. A healthcare agent with durable power of attorney is the person chosen to make the final decisions about the patient's end-of-life healthcare. Which of the following situation is not considered to be a reportable incident? Case of bronchitis. The Occupational Safety and Health Act was legislation passed to ensure all of the following except more control for employers over employee non-worker hours. Which of the following federal agencies was formed as the first attempt to establish consumer protection in the manufacture of drugs and foods? FDA Food Drug Administration. The Clinical Laboratory Improvement Act of 1988 was developed for all the following reasons except to increase the waiting time for specimen results. All of the following accommodations may be made to comply with the regulation as recommended in the Americans with Disabilities Act except replacing stairs with elevators in all buildings. Which of the following terms states that a physician is liable for the negligent actions of any employee working under his or her supervision? Respondeat superior. The process of preparing documents by converting dictated physician notes into written documents is called transcription. Which of the following would be the best salutation to use in a business letter? Best regards. Which device protects a computer from electrical damage? Surge protector. All of the following are examples of computer hardware except system software. Which of the following is a pointing device that notifies the user where the next letter, number, or symbol will be placed? Cursor. Which of the following is not a subjective symptom? Fever. Who owns a patient's medical record? The information in the record is owned by the patient, and the physician or medical facility that created the record owns the paper medical record. Medical records are used for all of the following reasons except to keep track of the patient's financial transactions. Medical records are classified as closed, active, or inactive. Which type of medical record filing system offers the most privacy? Numeric. All of the following are advantages of the numeric filing system except an alphabetic card system. All of the following statements describe strict chronological filing except that problem list is arranged according to the patient's past history. Which of the following would be considered an example of objective clinical evidence? High blood pressure, elevated temperature, and swollen ankle. All of the following should be considered when selecting the file cabinets for a medical office except whether or not the office uses color-coded files. Which type of mail should be used when proof is needed that patient received a letter sent by physician's office? Certified mail. How many digits are contained in the zip plus 4? 9. Where on an envelope should notations such as confidential and personal be included? Type directly below the return address. Correct USPS abbreviation for the state of Maine. Math procedure to follow when opening mail is to place the most important mail on top. Annotating is jotting down notes about an action needed to be taken in the letter's margins. Which of the following should be placed on the top when sorting incoming mail? A letter marked personal. Which of the following patients should be seen first if all of them arrived at the walk-in center at approximately at the same time? A 56-year-old male with dyspnea. Which type of scheduling system schedules 3 patients at the beginning of each hour? WAVE. CPT codes are used to code procedures. Medicare Part B covers all of the following except inpatient hospital visits. Which part of Medicare provides prescription? Part D. Tricari was formerly known as Champus. Which of the following coding systems is used to identify and code diseases on insurance claims? ICD-9 CM. Which type of ICD-9 code is used to classify external causes of poisoning and injuries? A codes. Which terms is used when describing the amount of money owed by the medical office for products and services purchased on credit? Accounts payable. The role of the medical assistant when checking in a patient is to confirm office coverage for patient's insurance plan. When an insurance policy pays a percentage of the balance after application of the deductible, it is referred to as coinsurance. When more than one policy pays on a claim, it is called coordination of benefits. When both parents married are covered by health insurance, claims for the family are paid according to the birthday rule. A method of containing hospital costs has been adopted with a system called DRGs. Which of the following is not a federal health insurance program or state health insurance program? COs. What percentage will Medicare pay on an allowed claim? 80%. Mrs. Lee, a patient of Dr. Chad, is charged $80 for a visit. Medicare allows $60 for this visit and paid $48. Because Mrs. Lee has already met her yearly deductible, how much will she have to pay the physician? $12. Which volumes of the ICD-9 books are needed for coding diagnoses in the medical office? Volume 1 and 2. Place the following medical records in alphabetic order, 23, 4, 1. Codes that cannot stand alone are E-codes. Insurance policies that include coverage on a fee-for-service basis are called traditional insurance policies.